So we've been doing impact surveys since 2007, roughly every 4 to 5 years. COVID obviously interrupted that. I think from the most recent survey and reflecting back over the last 15 years, one of the real surprising facts is that the time to diagnosis hasn't really changed. So an individual in 2007, generally speaking, was as quickly diagnosed as they are in 2023. Not only do we see this information in the survey that we've done, the impact surveys that we've done, but in my other role as a nurse consultant, we see new people coming into clinic, having gone through that same process. So we actually see the reality is the same. These people are still taking as long to get a diagnosis. And what does that make a difference? Well, it does. I mean, one of the differences is that in those 15 years, we've seen a significant development in the way that we manage and treat people with PH. Some of those changes have been new medicines, but also how we use those new medicines. But there's no point in some ways in having that development if you're not getting the patients in, because there's such a delay, as you can see from the figures, there is such a delay to diagnosis. And that remains not only a frustration, but it's actually preventing the best use of the medicines and the treatment pathways that we've got. There's also the economic impact of not being diagnosed with the condition, and in this case we're obviously talking about pulmonary hypertension, but there's some really important work done by our colleagues at Imperial College in London looking at the diagnostic delay in rare diseases. And in the last 10 years, just to NHS England alone, that cost £3.4 billion. And of that £3.4 billion, some of that cost will have been patients with PH. So I suppose, you know, to summarise the impact survey, what it showed this year, and it has done each time that we've done it, but this year, is that it has a massive impact on the individual. These individuals have a condition, a really impactful condition, that isn't receiving appropriate management and treatment. It has an impact on their psychological well-being, often feeling as though they're not being believed, increasing symptoms, worries, etc. Can anything be done? It has an impact on their families. It can impact on the families as a relationship, because if people's sort of conditions have changed. We know that it has a significant impact on their finances, because, you know, not being able to work full time, whether it's the individual with PH or the husband, the wife or whatever, not being able to work full time because they're needing to provide care. But not forgetting also what an impact it has on the NHS. You know, we're all taxpayers in one way or another, and we want the best value for money. And we as an organisation want to ensure that's the case. But going back to this diagnostic delay and this £3 billion being spent on that diagnostic delay will be better being spent on new treatment development, services, staff, etc. So it's the three areas: impact on the individual, impact on the family, and impact on the NHS and as a society as a whole. So it has to be addressed. Everybody's a winner if we can address these issues. The clear message is, at the end of this survey in 2023, is that we cannot continue doing what we've done for the past 15 years, because if we do, we're just going to get the same results, okay? And that's just not good. We're just not going to move on. So we have to think, how do we do this differently? We have to learn from it, okay? How do we do that? I think first and foremost is, and I've said it before, is we have to listen to patients themselves. One of the things that we all know with PH is that our patients are breathless, but they're not voiceless. And we need to listen to those voices. We need to give people the skills to advocate for themselves. And that's what we do as an organisation, as a PHA UK. So we have to do that. We as an organisation need to be a platform and a forum in which we can, again, engage with, keep calling these the stakeholders, NHS England, pharmaceutical companies, hospital settings, those sorts of things. And look, you know, how do we do something? We're in 2023, it's in the news all the time, artificial intelligence. Why can't we use that to the benefit of trying to look, where do these people normally go through? So what's the normal pattern for a patient with PH? They go to a GP, they go to Dr A, Dr B, Dr C. There must be, it's not beyond any realms of possibility that artificial intelligence and all that technology can be used. I said earlier that one of the things that is definitely the case here is there is system failure now. The NHS is a superb organisation of managing millions of people, but we need to use new technology to follow those people better, so the outcomes are better, that respond to those individuals better. I think one thing that really, just to close with, that's really important is over the last 15 years, there's literally been thousands of people with PH, with this rare condition, who have lost their lives. And got involved in our survey work, and it's made a difference already. Okay, so while things have not changed, there has been positive. We've got access to treatment, so we've got better services, etc. But I want to say thank you to those thousands of people and their family, their relatives and friends for getting involved in this, because it makes a difference. And we won't be in a position to try and change something if your voice wasn't there. And again, we as an organisation, about being a platform in which that voice comes together, that community voice comes together and says, we cannot continue doing 15 years worth of this, because these individuals, these thousands of people over the last 15 years are trying to lay a better pathway for the future, and that's what we're about as well. And over the past 15 years, the one common, really loud message all along is that the impact of a delayed diagnosis of PH is devastating. So of all these thousands of people, the one thing can be really clear about is they deserve better.